My name is Dr. Steve Bartels. I direct the Dartmouth Centers for Health and Aging, where we conduct research and provide training in a variety of disorders. But in particular today, I'm here to talk to you about a series that we put together in collaboration with our colleagues at the University of Oklahoma to address Alzheimer's disease. And as you know, Alzheimer's disease is an epidemic at this time in which 5 million Americans currently are affected by this disorder, and it's predicted that by the year 2050 it'll be as high as 13 million. And what we know is that the people that are frequently tasked with taking care of this very difficult disorder are family caregivers and primary care physicians. And so this series is directed at you, those of you who are primary care practices in the community, dealing with this disorder every day, as well as family caregivers and family members who are working with their loved ones every day to deal with this difficult disorder. In closing, I'd like to thank the Health Resources Service Administration for providing support for these videos. We hope that you will find them practical and valuable in your work together, primary care providers and families, in addressing this public health challenge.
Hello, my name is Keston Blandon. I'm a psychologist and I specialize in dementia. This video is the first of 3 for dementia family members about living with Alzheimer's disease. In this first video, we'll talk about early stage Alzheimer's. You'll meet Jill and Mark, a couple living with Alzheimer's disease, and you'll hear from social workers, chaplains, psychiatrists, and geriatric physicians who all work with people and families living with dementia. Today, we'll discuss legal and financial matters, education, adapting to early stage symptoms, and lifestyle changes for brain health. Meet Mark and Jill. A few months ago, Mark received a diagnosis of early Alzheimer's disease. Before retiring, Mark was an accountant with his own practice. His wife Jill was an educator. They have an adult son, Tom, and they live together in their home.
Well, I'm often asked, how can we tell which stage somebody is in, which stage of dementia? And the stages of the disease really don't have any clear boundaries. It's more like a spectrum of grays. For some people, they might be experiencing some symptoms a little earlier in the process, and others will come a little later. So instead of looking at symptoms, it might be more helpful to consider somebody's ability to function. And usually in the first stage, someone's ability to function is quite high. It's pretty much, they pretty much can do a lot of things on their own in the same way they've always been able to. They might need a little bit more assistance, but it's fairly safe to expect that they will be safe on their own. They probably will not get confused and wander off, for instance, or they might not need a lot of help getting food or feeding themselves. And if they'll know if they need help, they'll be able to dial 911, for instance, and they'll be able to ask for help. But dementia is a progressive disease.
The social worker said to us, I never met anyone who said, we started to plan for how to deal with this way too early. I wish we had waited. I laughed when she said it. I'm not laughing now. It was smart advice. Hard to think about, but good to do.
This is going to be difficult. I've been diagnosed with early Alzheimer's disease, and I need to take care of this.
Well, I'm very glad you're here.
It's never too early to get professional advice and guidance on advanced directives, financial planning, and education. It can help to think about long-term plans now to make sure things are in place when you need them.
Mark was an accountant, so our financial life was always well ordered, but I thought that we should seek expert advice on legal and financial arrangements in light of his diagnosis. He was defensive at first, saying that he had taken care of everything. I said I wanted him to still take care of everything now, by making sure that his Alzheimer's wasn't going to have a negative effect on all of the careful planning he'd done for us over the years. That motivated him. After it was done, he was glad we'd done it.
By addressing legal issues early, you can involve the person with dementia, and they can make sure decisions about their future are made according to their values. Many people with dementia find that making these important decisions can be empowering. Getting educated on Alzheimer's disease is very important for family members. Alzheimer's is a type of dementia, a progressive brain disease, so the symptoms can alter personality traits and habits.
So early stage symptoms can often be very confusing and distressing both to the patient and to the caregivers. Early on in the disease, the symptoms that are exhibited by the person with dementia can often be challenging to determine whether or not it's actually from the disease itself or if it's a personality trait of some sort.
Early stage symptoms can make simple, basic tasks difficult, and this can be embarrassing and frustrating for the person with dementia and hard to understand for the family.
I can still do most of the things I've always done. Sometimes I do them more slowly. Occasionally I need help. It's frustrating. I've always been a very patient person. And now I lose my patience more easily. You feel stupid not being able to figure out things that you've always been able to do. And, I know Jill feels bad for me, and she tries to soothe me. And sometimes it's just not okay, and in those times I want to be alone and wait till I stop feeling that way.
The hallmark presenting symptom of Alzheimer's disease is short-term memory loss, such as repetitive questions, repeating stories, not remembering an entire event. But there are a range of other symptoms as well. Difficulty with typical tasks, such as balancing a checkbook, operating a TV remote, maneuvering through the internet, or following a recipe.
Problem solving and serial planning can be particularly difficult in person with dementia in the early stages, and as Mark said, can be frustrating, especially with misplacing things and difficulty finding their words. Other things that they can experience, things like depression, anxiety, emotional sensitivity, these are all very common in the early stages.
I try to help or assist without being too intrusive or obvious. He wants to retain his independence. It's very important to him. But the reality is, he needs help with some things. So I try not to be reactive when he's upset, and I do not tell him how many times he's asked me or told me something. How's it going? Can I help? Here, let me try. Oh, and I learned to give just one direction at a time. Holding several steps to do in his mind at once is challenging. You could sum it up by saying, I try to make it easier for him to have Alzheimer's disease.
So Jill's thinking about activities for Mark, which is great. The main goal for a person with dementia in the early stages is to stay as engaged and as socially active as long as they could. Sometimes you will need to encourage your loved one to get engaged, and sometimes that's all what they need to stay active.
I had you over because I've received what I think is bad news. I'm afraid of looking stupid in front of people. But Jill really wanted me to think about telling people. She pointed out the stress I have from fear of memory loss, and I understand that, but it's hard. So we started with people closest to us who can support me without me feeling babied.
This may sound like it's going against the grain or a bit counterintuitive, but telling people within your inner circle about the disease, about the diagnosis, may be very important. So it's important to talk to your family member, your loved one, about the pros and cons of doing that. And typically a person with dementia will not be wanting to share that information. They might be afraid that they'll appear stupid, or they might feel like they'll be abandoned or rejected by their friends and loved ones. They'll also talk about how stressful it is to be constantly having to hide the symptoms, and they're afraid of doing something embarrassing in public. And for these reasons, oftentimes what happens is they become more socially isolated, and at a time when really it's very important for them to be engaged in life and be engaged in relationships.
So a key goal in early stage Alzheimer's disease is to maintain the person's independence for as long as possible. There are a variety of different mechanisms in which we want to engage patients in healthy behaviors to promote brain health, to allow them to maintain their autonomy for as long as possible. First, manage your numbers: your weight, blood pressure, cholesterol, and diabetes. A brain-healthy lifestyle is based on regular physical activity. People ask, how much? The benchmark is moderate intensity walking for at least half an hour, at least 3 times a week. Get this level of activity doing whatever you'd like to do: yoga, tai chi, dancing, walking, swimming, tennis, gardening, landscaping, chores. It's about staying physically active and having fun while you're doing it. Eat a heart-healthy diet of fresh vegetables, lean proteins, grains, and pastas. There are many diets that promote brain and heart health, but ask your doctor specifically based on your own medical problems and issues.
Well, you could have done a little better, Viney.
Stay socially active. Do the things you enjoy doing. It's understandable that someone with dementia may want to withdraw from fear of being embarrassed. Do what you can to alleviate that. Social engagement improves quality of life, and having friends feels good. And importantly, it's also part of reducing stress and depression, which, along with a good sleep, is an important part of a healthy lifestyle.
Night, sweet dreams.
In this first video, we discussed common issues of living with early stage Alzheimer's disease. We talked about legal and financial matters, education, adapting to early stage symptoms, and lifestyle changes for brain health. I encourage you to address and learn about these issues and topics early. And remember, enjoy your life. By taking care of long-term plans now and engaging in a healthy lifestyle, you can still have a high-quality life available to you and your loved one.